is she?
Hi, Gisli.
Her past history was she has a 20-year history of hepatitis B carrier, but no episode of acute hepatitis. She has also hypertension, but well controlled by medication. Otherwise, her past medical history is unremarkable.
Good.
And
are
right?
her blood counts good?
Yeah.
Okay.
Blood counts
So-
good, and LDH normal.
LDH is normal?
Yeah, normal.
Okay. So my impression is that it is just a recurrence of the marginal zone lymphoma. And I think there are a number of good signs that she doesn't have relapsed diffuse large B-cell lymphoma. One is that it's responding so beautifully to rituximab alone, which we occasionally see in newly diagnosed disease. But if she were having large cell lymphoma relapsing a year after epirubicin-based therapy, then I wouldn't expect a rapid response to rituximab alone. The fact that it's responding this nicely really suggests it's a low-grade histology. And that's consistent with most of the pathology reports. There's only one outlier that suggests large cell lymphoma. So I find that very encouraging, and I think especially given her age, where treatment for diffuse large B-cell lymphoma would be more intensive, that it makes sense to do lower intensity treatment for marginal zone lymphoma, which she's already responding to. Now, she's received rituximab many times before, and she's clearly responding, but I would predict in the relapse setting that her response duration for rituximab alone would only be about a year or less. So I would prefer, to the responding well, to treat some additional therapy. And there are a number of options right now. I think the most appealing option would be rituximab plus lenalidomide. Rituximab lenalidomide has been very well studied in relapsed follicular and relapsed marginal zone lymphoma. It does appear better than rituximab alone. The best clinical trial we have for relapsed low-grade lymphoma was done in Germany, and it was a randomized trial. Not in Germany, in the United States. And that study showed a response rate of 76%, with 40% of patients having a complete remission, and the median progression-free survival was just over 2 years. And those were all patients with relapsed disease. So a 2-year progression-free survival is quite good. The study gave everybody 6 months of therapy, but we also know that the lenalidomide can be dosed